Welcome to the combined virtual and in-person emergency department care pilot project. As you know, the Emerge can be a busy place, and we are all working hard to provide the safest environment we can. In preparation for increasing patient volumes and space constraints, the emergency department is conducting this combined virtual and in-person care pilot project. Interested patients can volunteer to download a secure messaging app and use it for video, text, and voice memo communication with their healthcare team. The app can be used to notify patients when it's time to go for tests, when their care space is ready, and when their results are ready. In some cases, once the healthcare team has determined it's safe, it may be possible for select patients to distance themselves from the usual waiting areas and wait outside the department, provided they monitor the app and can return promptly.
The Signal Communication app does the heavy lifting. It provides secure 128-bit end-to-end encrypted communication. It's similar to WhatsApp, but is provided by a non-profit organization dedicated to free, private, secure communication.
If you'd like to participate, it's important that you understand the potential risks and benefits so that you can provide informed consent. Please follow along with the patient information handout that you were provided. This is a voluntary pilot project, and you will still get the same great care regardless of your participation. If you do join in, you can change your mind at any time. Simply stop using your smartphone and just interact face-to-face. There are some privacy risks. Communicating using the Signal app is encrypted and secure, but there is risk that portable tablets and phones could be misused or stolen. Your name and phone number will be stored on these devices. There is a possibility of risk to your health. If you and your healthcare team decide it's okay for you to wait outside the department and you become more sick, it could be hard to get immediate help. We can't physically care for you when you're outside of the department. If you're feeling unwell, the best thing to do is to return to the department, find a nurse, and tell them in person. There is a risk that messages you send over the Signal app may not be received in a timely manner or may not be received at all. Signal is not continuously monitored by your healthcare team. If you need immediate help within the department, speak with a nurse. If you're outside the department and urgent help is not available, dial 911 using a traditional voice call on a landline or mobile phone. There is some risk to your phone. Downloading a third-party app can cause problems. Our experience with Signal has been good, but it's up to you to understand and accept the risks before installing any app onto your phone. Protect yourself and your privacy by never texting personal information and choosing video calls instead. Add a second level of protection by setting the Signal conversation disappearing messages to 6 hours. That way you know your conversation will be automatically deleted from the hospital device after your visit. Always authenticate the people you are communicating with by asking to see the healthcare worker's ID and showing them your wristband. It's important to know that Signal cannot be used to contact your healthcare team after you have been discharged from the emergency department. Your number will have been blocked, your messages will not be received, and please note, Signal will not notify you that you have been blocked. After discharge, if you need help, call 811, 911, visit your primary care provider, or return to the emergency department. If you'd like to participate in the pilot project, talk to your nurse, confirm it's a good fit for you, and then ask them to document your consent in your chart, and then follow the patient setup instructions. Click on the QR code or go to this website, then follow the instructions to install Signal, then send your first message. At the end of the visit, we'll send you a link to a patient experience survey. Please take the time to complete it so we can improve this process for the future. That's it for now. We look forward to caring for you during your emergency department visit.